In the spring of 2024, a 38-year-old oncologist named Dr. Anya Patel sat at her desk at a regional cancer center in Cleveland, Ohio, and made a treatment decision for a 56-year-old breast cancer patient named Marisol Reyes. The decision was guided in part by a recent meta-analysis published in a peer-reviewed Wiley journal showing favorable survival outcomes for a particular off-label combination therapy. Dr. Patel had read the paper carefully. The methods looked sound. The statistics looked clean. 14 months later, after Marisol's tumor had progressed faster than expected and a second-line therapy had failed, that meta-analysis was retracted. It had cited 11 underlying clinical studies. 7 of them were fabricated. They were not real studies. They were generated by an AI tool sold by a paper mill in Russia and inserted into the scientific literature for somewhere between $400 and $1,200 per authorship slot. Marisol died in October of 2025. Her doctor still keeps the printed copy of that retraction notice in her desk drawer. This is not an isolated incident. In 2023, Wiley shuttered its acquired imprint Hindawi after retracting more than 11,000 papers in a single rolling sweep. Springer Nature retracted close to 3,000. Elsevier flagged thousands more across its catalog. The reason was the same in every case. Coordinated networks of fabricated submissions, generated or heavily assisted by large language models, slipped through peer review at industrial scale and embedded themselves in databases like PubMed, Scopus, and Google Scholar, where they sat for years being cited and built upon by legitimate researchers who had no way of knowing the underlying data did not exist. The industry that produces these papers is called a paper mill. The largest known operators sit in Russia, China, Iran, and India, with growing nodes in Egypt, Indonesia, and several former Soviet republics. They have public-facing websites. They take orders by email. The product is straightforward. For a fee starting around $400 and rising to around $3,000 for higher impact journals, a researcher can buy authorship on a publishable academic paper. The mill writes the paper, fabricates or recycles the data, runs it through stylistic polishing using AI, submits it to a journal, manages the revisions, and delivers a published citation under the buyer's name. The mills openly advertise turnaround times of 60 to 120 days. They guarantee acceptance at journals in specific impact factor brackets. They issue refunds if rejected. The customers buying these slots are not amateurs. The largest buyer category, according to investigators at the Committee on Publication Ethics, is mid-career academics at universities in countries where promotion, tenure, and government research funding are mechanically tied to a fixed number of indexed publications per year. A medical school faculty member in a country that requires 3 Scopus-indexed papers per year for promotion can purchase those 3 slots from a Chinese mill for under $3,000 and meet the requirement without ever writing a paper. The second largest buyer category is medical residents and PhD students under degree completion pressure. The third, and the most recently emerging, is corporate buyers, small biotech and supplement companies that commission positive result studies on their own products and slip them into low-tier journals to use in marketing. What changed in 2023 and 2024 was not the existence of paper mills. They have been operating since the early 2010s. What changed was the throughput. Before generative AI, a mill needed a stable of human ghostwriters with real field expertise. The cost floor for a passable manuscript in a technical field like oncology or materials science was real. Output was limited. After GPT-class models became widely available and were fine-tuned on biomedical corpora, the cost floor collapsed. A single mill operator can now produce a publishable-looking biomedical paper in under 4 hours, complete with fabricated patient cohorts, plausible statistical tables, AI-generated Western blot images, and a reference list deliberately seeded with citations to other paper mill products to inflate their apparent legitimacy. Investigators at the integrity firm Cactus Communications estimate that the total annual paper mill output now exceeds 120,000 articles per year, roughly 4% of all biomedical publications. The actual percentage in specific subfields, including stem cell research and certain cancer biology areas, is believed to exceed 20%. The detection problem is hard. The first generation of mill papers, in the late 2010s, were caught by image forensics. Editors at journals like the Journal of Cellular Biochemistry and PLOS One noticed that the same Western blot panel, with minor cosmetic rotations or recoloring, appeared in dozens of unrelated papers. A small group of volunteer integrity investigators, including the microbiologist Elizabeth Bick, built reputations by spotting these duplications by eye. The mills responded by switching to AI image generation. The blots are now fabricated from scratch by diffusion models trained on real blots, and they pass nearly all automated similarity checks. The text underwent a similar evolution. Early mill papers had telltale linguistic fingerprints, odd phrase substitutions like vegetative force for plant power or colossal information for big data, evidence of round-trip translation. Recent papers polished by GPT-class models read cleanly. Tools that attempt to detect AI-generated academic text by perplexity scoring are below 60% accurate against current generation outputs, and they generate enough false positives to be unusable as a sole criterion for rejection. The downstream harm goes far beyond reputation. In medicine, the harm is direct and measurable. When fabricated clinical trial data enters a meta-analysis, and the meta-analysis enters a clinical practice guideline, treatment decisions get made on the basis of evidence that does not exist. In the Hindawi sweep, at least 41 of the retracted oncology and cardiology papers had been cited in published clinical practice guidelines or systematic reviews used to inform care. Tracing patient-level harm is methodologically difficult because the chain from a contaminated citation to an individual treatment decision is rarely visible, but the magnitude is not in question. In materials science and engineering, the harm is wasted research budgets. Graduate students spend years trying to reproduce findings that were never real. Funded labs pursue dead-end mechanisms because the foundational paper that proposed them was fabricated. The National Institutes of Health has estimated that fraud-related waste in federally funded biomedical research now exceeds $2 billion per year. The platforms taking action are the major publishers and a small group of integrity organizations. The Committee on Publication Ethics has tightened its guidelines for paper mill detection. The STM Integrity Hub is a cross-publisher database that flags suspect manuscripts before peer review, using submission metadata, author network analysis, and text fingerprinting. Retraction Watch maintains the most comprehensive public database of retracted papers and has been instrumental in tracking the scope of the problem. PubPeer hosts post-publication peer review and is where many mill papers are first flagged by the integrity community. Wiley, after the Hindawi disaster, dismantled the entire Hindawi imprint and rebuilt its editorial pipeline from the ground up. Springer Nature deployed a tool called Geppetto, named after the woodcarver, to scan for the linguistic hallmarks of generated text. Major Chinese funding agencies have begun penalizing institutions whose researchers are caught buying authorship. None of these measures has yet produced a meaningful drop in mill output. The economics still favor the mills. The people profiting are, at the lowest tier, freelance writers and editors in countries with low labor costs, who staff the back end of the mill operations. The middle tier is mill operators running organized businesses, often with offices, payroll, and customer relationship management software. The largest known operators are believed to gross between $3 and $20 million per year. At the top tier are a small number of academic insiders who serve as guest editors at compromised special issues, signing off on submissions in exchange for payment per accepted paper. This last category, the corrupted guest editor, is the seam that the Hindawi disaster exposed. Once a mill has captured a special issue editor, it can flood that issue with mill-produced papers in a single submission window. The Hindawi retractions were largely concentrated in compromised special issues. If you are a graduate student, a clinician, or a researcher trying to use the scientific literature in 2026, here is what integrity investigators say to do. First, treat any single paper as a claim, not a fact. The era in which a published, peer-reviewed paper could be assumed to represent real work is over. Verify before you cite. Second, use Retraction Watch and PubPeer when evaluating any paper you intend to rely on. If a paper has been discussed on PubPeer, read the discussion. If it has been retracted, the retraction may not yet be reflected in the citing databases you normally use, including Google Scholar. Third, be skeptical of papers in special issues, especially in journals with very fast turnaround times and unusually high acceptance rates. These are the structural conditions paper mills exploit. Fourth, if you are a clinician, prefer guidelines from major medical societies that have public, traceable methodology over commercial or aggregator-driven guideline products. The major societies are now actively screening their citation pools against the retraction databases. Fifth, if you are a journal editor or reviewer, know that the STM Integrity Hub is available to subscribing publishers and can flag the majority of obvious mill submissions before they reach human review. Sixth, if you encounter a paper that looks suspicious, fabricated cohorts, impossible statistical precision, images that look slightly off, citation lists that disproportionately reference other unknown papers in the same journal, report it on PubPeer or directly to the journal's integrity desk. Documentation is what eventually triggers retraction. Marisol Reyes is one patient. The retraction notice in Dr. Patel's desk drawer is one slip of paper. The 11,000 Hindawi retractions are one publisher's accounting of a single 18-month window. The literature contains more poisoned wells than anyone has yet found. The fix is not purely technical, because the mills will always be one model generation ahead of the detectors. The fix is structural. As long as a faculty member in any country can be promoted on the basis of indexed publication counts, without independent verification of the underlying work, mills will exist to meet that demand. As long as a clinical practice guideline can be built on a citation list, nobody checks for retractions, patients like Marisol will be treated on the basis of work that was never done. The next research paper you read may be real. It may also be a product. Verify before you trust it. Verify before you treat someone.